Hi, my name is Kyle. I'll be demonstrating a skull series today. It'll consist of 4 projections. It'll be a submento vertical, a lateral, a PA axial, and an AP axial. First thing I like to do is wipe down the room. Well, not the whole room, but at least our bucky. That's where my patient's face will be. So I'm going to give it a nice wipe. Alright, and I'm going to grab my patient, I'm going to ask why they're here, I'm going to get their full name, their date of birth. Right now I have the tube moved away so they can sit down once they get in here. Upon them sitting down, I'll position them on the clean bucky, and I'm going to detent my tube here to 40 inches. Which it is. It's detented at the wall and at the bucky at 40 inches. I would drop the tube, line it up with the bucky, and then continue to take my projection. Alright, I'm going to go grab my patient. First, I want to point out one thing. I'm in a full digital room. You won't see me changing out cassettes or anything like that. I'm going to go grab my patient. Denise?
Yes.
Hi, Denise.
Hi.
My name's Kyle.
Hi.
Can I get your full name?
Yeah, Denise Topla,
And your birthday?
4/14/88.
Okay, is there any chance of pregnancy? Okay, can I get you to take out your earrings and your hair tie?
Yes.
And if there's any other metal clips or bands or anything in your hair,
Yes.
you can set them right here. Alright, so what brings you in today?
I fell off a ladder and I bumped my head really hard, and now like my whole skull is hurting.
All around?
Yeah.
Okay. Alright, well I'm going to get a few images. I'm going to put this on you, but it's going to be backwards
Okay.
for the first couple. So you're going to be facing this board here. Go ahead and have a seat. I'm going to move you closer. Okay, sit down. And if you can put your right side of your face against this board. It's already been cleaned, as I stated in the introduction. So I'm going to bring down her chin so that her OML is perpendicular to the IR. I'm going to go ahead and move up my tube so that the central ray is 2 inches superior to her external auditory meatus. We're going to collimate. Now this board's going to move, okay? Just watch your face. And everything's detented to the wall and the bucky, and we're shooting every image at 40 inches. Okay? So we're 2 inches above. And our OML is perpendicular. I'm going to take this at about 80 at 12. I'm going to take my image. X-ray. Alright, for our next one I'm going to do a PA axial Caldwell method. It's going to have a 15-degree caudal angle. Alright, Denise, if you can put your forehead and nose right against the board. And this time I'm going to mark it because the last one I didn't. Should have put a right marker. So this time I'm going to put a left marker there, indicating what side. Okay? The board's going to move, Denise. Alright. So I have the central ray exiting at the nasion. And it's perfectly exited at the nasion. I'm going to shoot this at 80 at 20. X-ray. Okay, Denise, you want to stand up for me? And we're going to turn this around. We're going to put it on regular. Go ahead and have a seat here. Okay. You want to go ahead and close your eyes. It's a bright light, okay? I'm going to switch my marker to the left side. And this is what we call an AP axial town. And I'm going to have a 30-degree caudal angle. And I'm going to position the central ray to enter right at 2.5 inches superior to her glabella. I'm going to scoot you back a little bit. The board's going to move. Sorry, it senses this chair, sorry. There it goes. Alright. Alright, hold still. Just like that. Collimate in just a little bit here. Alright. I'm going to go ahead and shoot this at 80 at 24. X-ray. And the last projection we're going to do is called a submento vertical projection. And I'm going to scoot her chair out a little bit. Go ahead and scoot forward. And if you can extend your head back. There you go. Okay. Now, we want the central ray to be about 3/4 of an inch anterior to her external auditory meatus. So the central ray is just right there 3/4 above, and it's going to enter in between the angles of the mandible. And this is perfect positioning. You can see her eyelashes fluttering. Beautiful eyelashes, Denise. Alright, and I'm going to shoot this at 85 at 24, and it's also known as a Schuler method. X-ray. Alright, Denise, that concludes today's exam. Did you have any questions?
No.
Okay. I'll get this red apron from you. Wash your head.
Okay.
You're welcome. Have a good day.
Thanks.
Thank you.
Here we have our submento vertical projection. You can see here the dens, or the odontoid process, is peering through the foramen magnum. We have our mandible, zygomatic arches, ethmoidal sinus, and also you'll see the occipital bone. This here is our town method. Point out here, this is our parietal bone, occipital bone. You can see the foramen magnum, the dorsum sellae, and a petrous ridge. This is our PA axial Caldwell. You'll see the frontal sinus, crista galli, supraorbital margin, infraorbital margin, petrous ridge, and right here is our ethmoidal sinus. Here's our lateral view. You can see our coronal suture, dorsum sellae, external auditory external auditory meatus, maxillary sinus, sphenoid sinus, you have our frontal sinus, nasal bone, mandible. Here's the body. Here's the rami.